Part A. Extract 1. Questions 1 to 12. You hear an oncologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, how are you feeling today? I know you had a bit of a reaction to the last round of chemotherapy.
Hi Dr. K. Well, honestly, I'm a little shaken. It all happened so fast during the infusion.
That's completely understandable. Can you tell me exactly what happened? What kind of symptoms did you experience?
Well, it started with a bit of itching on my arms, and then all of a sudden, I felt really flushed. My chest got tight, and I had trouble breathing. It was terrifying.
Okay, that sounds like a serious allergic reaction. Did the nurses attend to you right away?
Yes, they were amazing. They stopped the infusion and gave me some medication, and thankfully, the symptoms subsided quite quickly.
Are you still experiencing any of those symptoms now?
The rash has mostly gone away, but I do feel a bit tired and lightheaded sometimes.
I'm glad to hear it.
I'm also worried about my foot ulcer. It seems to be getting bigger.
An ulcer, you say? That's something new. Can you tell me more about it?
It started as a small blister a few days ago, but it's gotten quite red and painful. I'm worried it might be infected.
It's possible the allergic reaction or the chemotherapy itself could have compromised your immune system, making you more susceptible to infection.
That makes sense.
Now, have you experienced any other allergic reactions in the past, to medications or anything else?
No, never. This is the first time anything like this has happened. I don't understand why this would suddenly develop.
Allergies can sometimes appear out of the blue, especially with medications like chemotherapy drugs or even medications you've taken previously without issue. It's possible your body has developed a sensitivity to one of the components. Let's run some further tests to see if we can identify the specific drug that caused the reaction. In the meantime, we'll need to adjust your treatment plan.
What does that mean? Will I still be able to get chemotherapy?
We might need to switch to a different chemotherapy drug. We'll perform a test to see if you're allergic to a medication called docetaxel.
All right. Is that as effective as the last one?
It has a similar efficacy rate, but of course, there's always a chance it might not suit you either. We might also consider immunotherapy.
Okay, I've heard about that. What does it involve?
Mihiraa, it has emerged as a significant advancement in the treatment of cancer. It works by harnessing the body's immune system to recognize and attack cancer cells more effectively. We can discuss the details further once we have the test results.
Okay, that sounds good. But what about now? How will we proceed with treatment in the meantime?
We can try delivering the next round of chemotherapy at a slower rate. This might lessen the chance of another allergic reaction. We'll call it a low-dose infusion.
A slower infusion, huh? Will that still be effective?
It might be slightly less effective, but it's important to prioritize your safety. We'll closely monitor your response throughout the procedure.
All right, that makes sense. When will I be back for my next appointment?
Let's schedule you for a follow-up appointment in 2 weeks. We'll have the test results by then and can discuss the next steps in more detail.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. So, what brings you to the dentist today?
Hi, Darren. Thanks for seeing me so quickly. The truth is, I've been having this awful toothache on my right side for a few days now.
I see. Can you tell me a little more about the pain? Is it sharp, dull, throbbing?
It's a sharp pain, especially when I bite down on something hard. It comes and goes, but it's getting worse. Sometimes it even radiates up to my cheek.
Okay, and when did this pain first start?
Well, I can't pinpoint the exact moment, but it must have been sometime over the weekend.
It's okay. Anything else would you like to add?
Yes, I remember having some sensitivity to cold drinks a day or two before the pain started.
Interesting. Now, have you had any recent dental work done on that side of your mouth? Fillings, crowns, anything?
No, nothing recent. Actually, I haven't been to the dentist in a few years, I'm afraid to admit.
That's all right, Mihiraa. Have you tried anything to relieve the pain so far? Over-the-counter pain medication perhaps?
Yes, I've been taking ibuprofen, but it only provides temporary relief.
Right. Well, based on your description, the radiating pain suggests there could be an infection in the tooth or the gum tissue.
An infection? Oh dear, that sounds serious.
Don't worry, it's quite common. To confirm and determine the best course of action, I'll need to take a closer look. Let me examine your teeth.
Okay, sure.
I see some swelling around the gum line on your upper right first molar. There's also a small cavity on the chewing surface of that tooth. These findings support my initial suspicion of an infected tooth.
So, what can be done?
There are a couple of options. The most likely scenario is that we can treat this with a root canal.
I've heard that can be a bit uncomfortable.
It's true that it can be uncomfortable, but modern techniques and anesthesia minimize the discomfort significantly.
What does it involve?
This involves removing the infected pulp from the inside of the tooth and then placing a filling.
Is there another option besides this?
In some cases, if the infection isn't too severe, we could try antibiotics and a filling, but depending on the extent of the cavity. Ultimately, the choice is yours. However, I highly recommend treating this infection as soon as possible to prevent further complications.
Okay, I understand. I'd like to discuss this with my husband before making a decision. Would it be all right if I call you back to schedule an appointment, depending on what we decide?
Absolutely, Mihiraa. Please don't hesitate to call us back. In the meantime, you can proceed with the over-the-counter pain medication for pain relief.
Thank you so much, Darren.
That is the end of Part A. Now check the answers. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Hey, have you seen the new hospital rule about patient discharge protocols? It's a bit confusing, to be honest.
Yeah, I skimmed through it, Mihiraa. Something about verifying medications twice before discharge, right?
Not just that. It's about verifying medications, but also ensuring the patient's family is briefed on post-discharge care. The tricky part is that it overlaps with the existing rule about double-checking prescriptions. So now we have to confirm the medications with the doctor, then with the patient, and finally with the family.
Wait, isn't that what we already do? I thought the new rule was about reducing paperwork.
That's the confusing part. The rule says we're streamlining paperwork, but it adds more steps to the discharge process. For example, if the patient's family isn't available, we have to document why and reschedule the discharge. It feels like we're trading one problem for another.
So Mihiraa, it's not really saving time.
Exactly. It's supposed to improve patient safety, which is great, but it's creating delays. And if we miss even one step, like forgetting to document the family briefing, it counts as a protocol violation.
Sounds like we'll need a checklist to keep track of everything.
Definitely. But even then, it's going to be a challenge, especially during peak hours.
Now look at question 26. You hear a doctor called Mihiraa talking to an X-ray technician. Now read the question.
Hi, I need an X-ray for a new patient, Mr. Horner. He's got a history of chronic back pain, but this time he's complaining of sharp pain in the lower left abdomen. I suspect a possible kidney stone, but I also want to rule out any spinal issues.
Got it. So Mihiraa, you want a lumbar spine X-ray and an abdominal X-ray?
Not exactly. I need a KUB X-ray, kidneys, ureters, and bladder to check for the stone. But here's the tricky part. He's also had a recent fall, so I'm concerned about a potential fracture in the lumbar region. However, if we do both, the radiation exposure increases, and he's already had a CT scan last month for something else.
That complicates things. Should we prioritize the KUB or the lumbar spine?
Ideally, both, but we need to minimize radiation. Let's start with the KUB since the abdominal pain is acute. If that doesn't show anything, we'll reassess the lumbar spine. But keep in mind, if the KUB is inconclusive, we might have to do the lumbar X-ray anyway, which could delay treatment.
Mihiraa, what if the KUB shows the stone but the pain persists?
Then we'll have to consider that the pain might be from both issues, the stone and a potential spinal injury. It's a balancing act between thoroughness and safety.
Now look at question 27. You hear a physiotherapist called Mihiraa talking to a colleague. Now read the question.
Hey, have you seen the new electrotherapy machine they brought in? It's supposed to be a game changer for muscle rehabilitation, but I'm not entirely sure how it fits into our current protocols.
Yeah, I heard about it, Mihiraa. Isn't it similar to the TINS unit we already use?
Sort of, but it's more advanced. It combines TENS with EMS, electrical muscle stimulation, and has a built-in thermal function. The problem is, it's not clear when to use it over our existing equipment. For example, if a patient has chronic pain and muscle atrophy, do we use this new machine or stick with the TENS and separate EMS units?
That does sound tricky. What's the advantage of the new one?
The advantage is that it's all-in-one, so it saves time. But here's the catch, it's more complex to operate, and if we use it incorrectly, it could overstimulate the muscles or even cause discomfort. Plus, it's not yet clear if it's better for acute injuries or just chronic conditions.
So, Mihiraa, it's not a straightforward replacement?
Exactly. It's great for certain cases, but we'll need training to avoid misusing it. Otherwise, we might end up complicating the patient's recovery instead of helping.
Now look at question 28. You hear a GP called Mihiraa talking to a cardiologist. Now read the question.
Hi, I've got a new patient, Mrs. McGrath, who's been experiencing chest pain and shortness of breath. She's got a history of hypertension and type 2 diabetes, but her ECG came back normal. I'm concerned it might be angina, but her symptoms don't perfectly align.
That's tricky. Did you check her lipid profile, Mihiraa? Sometimes diabetes can mask typical angina symptoms.
Yes, her cholesterol is elevated, but not drastically. The confusing part is that she also has GERD, which she says feels similar to the chest pain. So, it's hard to tell if it's cardiac or gastrointestinal.
That's always a challenge. Did you consider a stress test?
I did, but she's quite sedentary and has mild osteoarthritis, so a treadmill test might not be feasible. I was thinking of a pharmacological stress test, but her kidney function is borderline, so I'm worried about the contrast dye.
That complicates things. Mihiraa, what about a coronary CT angiogram?
That's an option, but her insurance might not cover it without a clearer indication of cardiac issues. For now, I've started her on nitrates to see if it helps, but I'm not entirely confident.
Now look at question 29. You hear a nurse called Mihiraa talking to a social worker. Now read the question.
Hi, I wanted to brief you about a new patient, Mr. Rosewood. He's been admitted with severe dehydration and malnutrition, but there's more to it. He's homeless and has a history of alcohol dependency, which complicates his care plan.
I see. Mihiraa, does he have any family or support system we can reach out to?
That's the issue. He mentioned a brother, but they're estranged. He's also reluctant to go to a shelter because of past negative experiences. On top of that, he's diabetic, so his malnutrition isn't just about lack of food, it's also poor management of his condition.
That's a lot to unpack. What's the priority here, his immediate medical needs or finding him stable housing?
Both are urgent, but if we don't address his housing situation, he'll likely end up back here in worse condition. The tricky part is that he's resistant to most of the options we've suggested so far.
What about a rehab program, Mihiraa? It could address both his alcohol dependency and provide temporary housing.
That's a good idea, but he's hesitant because he doesn't want to be locked in. We'll need to find a way to build trust first.
Now look at question 30. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Hi, I wanted to discuss Mr. George's medication side effects. He's on metformin for his diabetes and has been complaining of nausea and fatigue. I'm not sure if it's the metformin or his new antidepressant, sertraline, which can also cause similar symptoms.
That's tricky. Did you check his blood sugar levels, Mihiraa? Fatigue could be from hypoglycemia.
I did, and his levels are stable. But here's the complication. He's also on a low-dose beta blocker for his hypertension, which can mask hypoglycemia symptoms and cause fatigue. So, it's hard to pinpoint the cause.
True. What about his diet? Is he eating properly?
He says he is, but he's lost weight recently, which could be from the nausea. The problem is, if we switch his metformin to another medication, it might take weeks to see if the symptoms improve. And if we adjust the sertraline, it could destabilize his mood.
It's a balancing act, Mihiraa. Let's start by reducing the metformin dose slightly and monitor him closely. If the nausea persists, we'll reconsider the sertraline.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an occupational therapist, Mihiraa, and an interviewer.
Welcome, Mihiraa. It's a pleasure to have you here today to discuss the intricate work of an occupational therapist. To start, many people often misunderstand the role of an occupational therapist. Could you clarify what exactly your profession entails?
Thank you for having me. The work of an occupational therapist is often mistaken for a broad set of unrelated tasks when, in reality, it follows a highly specialized, structured approach. Our primary focus is enabling individuals to participate in meaningful activities, ones that support their independence and well-being. We deal with patients of all ages, from children facing developmental delays to older adults recovering from strokes or struggling with degenerative conditions. Unlike general rehabilitation, which often targets singular physical recovery, occupational therapy is rooted in function. If a patient has lost mobility in their hands, for instance, my goal isn't solely to improve movement, but to ensure they regain the ability to dress themselves, cook, write, or engage in activities that bring them personal fulfillment. This involves a combination of motor skill enhancement, cognitive training, behavioral adaptation, and environmental modifications. Our approach isn't just about regaining lost abilities, but restructuring daily life to accommodate new limitations without diminishing the quality of life.
That's an insightful explanation. Now, many confuse the work of an occupational therapist with that of a physiotherapist. How exactly does your role differ?
This is a common misconception. While both professions contribute to rehabilitation, our methodologies and ultimate objectives diverge significantly. Physiotherapists primarily focus on restoring movement, strength, and coordination, often targeting a particular muscle group, joint, or affected area after injury or surgery. They work extensively with biomechanics, pain reduction, and physical endurance training. Occupational therapy, on the other hand, isn't centered on movement alone, but rather on the practical application of that movement in real-life scenarios. Consider a patient recovering from a spinal cord injury. While a physiotherapist might work on regaining leg strength, I would be focused on how that patient can safely maneuver within their home, transfer from a wheelchair to a bed, or use assistive tools to maintain independence. Our scope includes cognitive, social, and psychological factors, ensuring that recovery isn't just physical, but also meaningful in a personal and social context.
That distinction makes the importance of your work even clearer. Speaking of significance, how crucial is the role of an occupational therapist in modern healthcare?
The necessity of occupational therapy can't be overstated, particularly as healthcare shifts towards a more holistic, patient-centered approach. We don't just treat symptoms, we facilitate lifestyles. This is particularly important for individuals with chronic conditions, where there may be no complete recovery, but an ongoing need to adapt to evolving challenges. Take a patient with Parkinson's disease. While medication and physical therapy address some symptoms, it's occupational therapy that helps the individual learn strategies to maintain daily function despite progressive degeneration. From modifying home environments to prevent falls to training in assistive technology for communication, our work ensures that patients don't just survive with a condition, but continue to engage meaningfully with their world. Our impact extends beyond individual patients to entire families and caregivers, offering strategies to make caregiving more effective while preserving the dignity and autonomy of the patient.
That's a broad scope of work. When working directly with patients, how do you typically approach treatment?
Each patient's journey is highly individualized. The first step is a comprehensive assessment, not just of their physical abilities, but also their cognitive function, emotional state, social support systems, and living environment. Unlike standardized medical treatments, our interventions are deeply personalized. I might work with a child on fine motor skills to improve handwriting while simultaneously addressing sensory processing challenges that make classroom learning difficult. For an elderly patient recovering from a stroke, therapy might involve cognitive exercises to improve memory, adaptive techniques for dressing, or environmental modifications to reduce hazards. There's also a strong psychological component. Many patients experience frustration, anxiety, or depression due to their limitations. Our role extends into motivation, fostering resilience, and breaking down overwhelming goals into manageable steps. Collaboration is key. We work alongside physiotherapists, speech therapists, psychologists, and medical professionals to create a comprehensive rehabilitation strategy that aligns with the patient's specific life goals.
That sounds incredibly transformative. What are the tangible benefits patients experience through occupational therapy?
The benefits are extensive and extend well beyond regaining lost skills. While restoring function is a priority, the deeper value lies in the empowerment of the individual. Take a patient with a traumatic brain injury. Our work might involve cognitive training, adaptive technology, and behavioral strategies that enable them to re-enter the workforce or resume responsibilities at home. It's about autonomy, confidence, and dignity. Even small victories, like an arthritis patient being able to fasten buttons without pain, have profound psychological and practical impacts. Beyond individuals, there's also a societal advantage. By promoting self-sufficiency, we reduce dependency on healthcare services and caregivers, ultimately easing economic and emotional burdens on families and healthcare systems.
That's truly impactful. However, Are there any complications or challenges associated with occupational therapy?
Absolutely. Like any medical intervention, occupational therapy isn't without its hurdles. The most prominent challenge is patient compliance and engagement. Unlike treatments with clear, short-term outcomes, our work often requires prolonged effort and adaptation, which some patients find discouraging. Cognitive impairments, psychological resistance, or financial constraints can also impede progress. Additionally, not all conditions respond to therapy in predictable ways. Neurological disorders, for instance, can have fluctuating symptoms, requiring constant reevaluation and strategy shifts. Accessibility is another issue. Many communities lack sufficient resources or specialists, leaving patients with limited options. Nonetheless, despite these challenges, the impact of even incremental progress in occupational therapy can be life-changing.
Now look at Extract 2. Questions 37 to 42. You hear a pharmacist, Randy Orlean, at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. It's an honor to speak to you about the outstanding services and educational programs available at Mihiraa Healthcare Institute, widely known as Mihiraa Care. As a pharmacist, I've seen firsthand how this institution combines academic rigor with real-world applications to create a dynamic healthcare environment. Mihiraa Care is not just about treating ailments, it is a holistic center of learning, patient care, and innovation. At Mihiraa Care, the key facilities go beyond traditional pharmacy and medical labs. Our infrastructure integrates digital diagnostics, pharmaceutical research hubs, and personalized therapeutic intervention units. The advanced laboratories are equipped to simulate real-time clinical situations, allowing students and practitioners to interact with cutting-edge medical technology. Additionally, Mihiraa Care offers a comprehensive medication therapy management center, ensuring that pharmacists are trained not just in dispensing, but also in medication reconciliation and patient-specific adjustments. Simulation chambers for crisis scenarios, from anaphylaxis response to multi-drug-resistant infections, allow learners to practice in high-pressure environments. These interconnected systems ensure that students and professionals grasp both theoretical and practical dimensions of healthcare. The assessment of patient needs at Mihiraa Care follows a multi-layered approach. Standardized diagnostic protocols are only the starting point. Patient profiles are continuously updated with genomic markers, lifestyle analytics, and AI-assisted predictive modeling. Clinical pharmacists work alongside medical professionals to tailor drug regimens, analyzing the pharmacokinetics of each prescription against patient-specific parameters. Mihiraa Care's emphasis on interdisciplinary collaboration ensures that treatment plans are not static but evolve with patient responses. This proactive engagement means that pharmaceutical strategies are constantly reassessed, mitigating potential adverse effects and ensuring long-term treatment efficacy. The institution's unique pharmacovigilance system further refines patient care, identifying patterns and adjusting regimens before complications arise. The central focus of Mihiraa Care is the fusion of pharmaceutical sciences with patient-centric care models. While many institutions separate research from clinical practice, Mihiraa Healthcare Institute integrates them, ensuring that emerging treatments transition seamlessly from theory to bedside application. Pharmacological advancements are analyzed within the framework of patient outcomes, embedding personalized medicine into the curriculum. Mihiraa Care's philosophy is not just about drug dispensation, but also about strategic medication optimization, leveraging genetic markers and patient history. The interaction between education and active medical engagement creates a dynamic ecosystem where students are not passive recipients of knowledge, but contributors to ongoing advancements. Innovation is embedded in every facet of Mihiraa Care's operations. The introduction of AI-driven medication reconciliation has minimized human error, ensuring precision in prescriptions. Mihiraa Care is also pioneering a blockchain-based pharmaceutical distribution system to enhance drug traceability and minimize counterfeiting risks. The institution has also developed a biofeedback integrated medication adherence program, where wearable technology tracks physiological responses to prescribed treatments, ensuring compliance and effectiveness. Beyond technology, the integration of psychological and behavioral sciences into pharmacotherapy has led to a nuanced understanding of patient adherence patterns, influencing how medication protocols are structured. Emergency preparedness at Mihiraa Care is both systematic and adaptive. The rapid response framework includes autonomous triage systems that categorize patients based on real-time biometric analysis. Pharmacists and medical teams undergo continuous emergency simulations, ensuring swift coordination in crises such as cardiac arrests, toxicological emergencies, and pandemic outbreaks. Real-time data integration between pharmacies and emergency rooms allows immediate access to patient histories, ensuring that treatments align with existing medical conditions. The institution's predictive modeling tools, which analyze epidemiological trends, enable Mihiraa Care to prepare for large-scale medical emergencies even before they escalate. Looking ahead, Mihiraa Care is committed to further bridging the gap between pharmacology and digital health. The next phase of research involves integrating nanotechnology into drug delivery systems, allowing for more precise targeting of diseased tissues with minimal side effects. The educational framework is also shifting towards a hybrid model, incorporating virtual reality simulations for complex medical cases. Mihiraa Care is also spearheading advancements in pharmacoethics, ensuring that the evolving landscape of personalized medicine maintains ethical integrity. The future of Mihiraa Care lies in its ability to anticipate changes in medical science and equip its students with the ability to lead these transformations.